Hi, good morning, everybody. Hey, thank you very much for joining us on our weekly webinar. I think it's going to be a very exciting webinar today. We'll talk about how pre-diabetic really affect your entire body, and is a good summary. Really can help you understand better why we have to do all these things. OK， 嗱，各位朋友，好多謝你今日咧係 join 我哋個講座啦。咁啊，多謝阿 Pat 啊，香港啊，今日有香港啦、中國啦、有新加坡啦、星馬泰啦、菲律賓啦、美國啦、加拿大啦，咁好多人嘅其實都。So it's really nice to have all these people joining us from all the United States, Vancouver, Hawaii today. Also have people from Philippines, Singapore. I think some of them, I don't know where they come from, but at least I know they're from Hong Kong, some of them, but some of the names, I'm not sure which country, but quite a few of them. So, but anyway, welcome. My name is Andrew Lau. I'm Lowsutea president, and on top of that, creator of Lowsutea. The reason why I do all that is because of the fact that I've realized that so many people have diabetes and pre-diabetic. If I can help them to basically, if they're pre-diabetic, not to convert to diabetes, and they can able to improve their health and get into all sorts of diabetic complications, I think I did my job. And if I can help the diabetic patient and then reverse back them to pre-diabetic condition, even or the condition, it go back to 5.7 A1C like a normal person, wow, I did my job too, because that would be even more benefit for many different people. So that's the reason why I felt that it's so important to have all these webinars. As a matter of fact, I had a customer from United States and a couple of them from Canada and different places. He said, we are the only company actually provides such a great, simple to understand webinar to help them to update. Is that none of them had that. The same way in Hong Kong and also Philippines and different places had a similar comment. So I thought that what we're doing, it is helping many different people. So I'm very happy to continue to do that. 嗱，各位朋友，其實咧，我亦都接到好多不同嘅信息啦，尤其是有啲喺加拿大啦，有啲美國啦，有啲喺菲律賓啦，亦都有啲喺香港或者其他地方。咁佢哋講到咧，佢哋話you know 即係你個節目好正喎，點解咁正咧？佢話因為咧，第一咧係冇咩人咧係可以做到呢樣嘢，令到佢哋覺得即係俾到一啲好 simple 嘅，唔係好難嘅information， 咁佢哋能夠可以跟得。咁其實咧就呢個係一個對我嚟講係好重要嘅，因為點解咧？當然啦，即係我諗我哋最重要嘅就可以知道，哇！原來我哋依家好多人咧係有糖尿病嘅，但係政府未必係有咁多嘅所謂嘅資源啦，去教育咩叫糖尿病啊，同咩點去能夠如果你係前期患病，前期患病係越少嘅，咁我點話翻俾你聽點去防禦你去唔會變咗前期患病轉糖尿病咧？呢個係一個好多人咧係覺得哇！我哋依家係俾一個好 program。咁依家我哋開始啦。So we're going to start our program. It was so nice that we have all these people joining us. I think it's so exciting. But matter of fact, it is so important to basically to acting that I know because I have a lot of new people. So I want to make sure we get to catch up with all the new people. So I'm going to give about 5 to 10 minutes just to let people catch up. What is diabetes? Okay. Now, as you know, diabetes is a chronic disease. You don't get well, and you can only control. The important why we always talk about that is because if you are diabetic or you are pre-diabetic, your body is start going forming plaques everywhere and plug up everywhere in a sense for your brain, heart, everything. So it affects your entire body blood vessels. And that is the most dangerous and most risk you will end up if you are a pre-diabetic or diabetic, okay? So all you got to do is control your blood sugar, prevent serious diabetic complications. And pre-diabetic is the same thing. So what that means is you have the proper dieting, exercise, weight control, make sure your blood sugar are controlled below 6.4 and or 125, 124 milligram per dil. And then you continue to do that, your A1C will drop down to between if you're 6.4 above, it will drop down below 6.4 all the way to 5.7. That will be the things that you got to do. So diet is very important. You know, change lifestyle, very important. You have no white food, meaning the rice, take very little or no rice, or, you know, you cannot drink soda, you know, like Coke and things like that, and juice. And then drink Lowsutea will help you to drink, it'll help you to on cold and hot, you know, whatever Lowsutea hot and cold, it still works. So just drink that so you don't have all these sugar get into it. That will be the key for you to control your blood sugar. 嗱，各位朋友，嗱，今日咧我諗大家都即係講咗好多啦。咁我首先講翻就係糖尿病係永遠唔好嘅。點解糖尿病唔好咧？就係因為佢會將個糖塞住晒，同埋啲膽固醇一齊，應該會有張 slide 話俾你係塞咗喺全身嘅血管。咁呢個咧就係由慢慢嚟，初期第1-5年可能冇跡象嘅，去到遲啲咧你就好多跡象出現咧就好弊啦。咁其實前期患病同埋後期患病，即係啲糖尿患病者一樣喎，要控制血糖，你只係能夠控制啊，你係唔會好嘅。咁你要降低你嘅 A1C 咧 ，HbA1c 咧由我嘅你嘅 number 去到降低個低6.4嘅，全世界咧去度呢樣嘢㗎啦，依家。咁如果你前期患病一樣要係呢個6，又唔可以上到嗰個6.5，一路係跌翻去5.7。咁點做咧？第一喺呢個食物方面要控制啦，低碳水化合物啦，要 control 你個 weight 啦，即係你磅數啦，要 exercise 啦，運動啦。咁其實咧應該會有啲嘢咧俾你係一個好容根嘅東西。咁你記住佢咧，我覺得你成功率咧一定好高。咁變咗嚟講，你就學你話齋，唔可以飲汽水啦、juice 啦，即係果汁啦、好甜嘅嘢啦。咁最好咧就可能夠飲到去糖茶咧，就幫助你一路慢慢降低你血糖、降低你卡路里、降低你嘅膽固醇。咁最後咧其實去糖茶係降低3高嘅，咁就會好正嘅。So, you know, we have been talking a lot about that. I think it will be so important to continue to drive that message to say that Lowsutea actually how can help you. First of all, I want to give you 4 stages of how diabetes work. Now, first of all, diabetes, when the first stage is your cholesterol goes up, it's called LDL cholesterol. That's bad cholesterol for your heart, basically. It goes up. But that when it goes up, it damages the B cell of the insulin coming out. And when that damaged, then you have no more B cell take the sugar to the cells. So more and more sugar come out, more and more it doesn't work. So we become insulin resistant. Your sugar will goes up, your cholesterol goes up. Now, when that add up together, now you have a second problem coming in. Your blood become thick. Wow, man, that is the real issue. Matter of fact, when cholesterol make a thick, blood become thick, your blood is going to form plaques all over the place in your entire body. Now, that is the major issue that you're going to face. When you get in the entire body, then you're going to start plucking up, and then your blood sugar goes up. Now, then you go into the third stage. Your sugar goes up, blood pressure goes up, and now the third stage comes in is the A1C going to goes up. The A1C is hemoglobin, the percent of sugar attached to this molecules called hemoglobin, which carry oxygen. So they measure the percentage of oxygen attached to each one of the hemoglobin. So they call HbA1c. If you 5.7 is normal, if you're 6.4, if between 5.7 and 6.4, you are pre-diabetic. Over 6.5, you are diabetes. So the fourth stage is if you don't do anything, don't change, you know what, your blood A1C will go beyond 6.4, is 6.5. Now you become a diabetic. Now, once you have 2 times in half a year, you measure A1C is over 6.5, then you're confirmed diabetic as your record. You can't go back. Okay, so keep that in mind. So net result, you'll forever become diabetes. 嗱，各位堂友，好簡單，有4個 stage。嗱，我每一次都話翻俾你聽，咁你可能你話咁鬼臭氣㗎，唔緊要，因為好多新朋友嚟啦，咁你越講得多咧，你明白咧，咁你要記住咧，咁你有多啲鼓勵性咧，俾你，哇！我真係要搞呢樣嘢喎。嗱，第一個 stage 咧，第一步咧就係你個膽固醇 LDL 呢個破壞心臟嘅膽固醇啊，佢要上嚟嘅。上咗嚟之後咧，咁就咧你個膽固醇再加埋啲糖咧一齊咧，佢就破壞咗你胰島素出嚟嗰個 B cells， ABB 嘅 B 啦， 個 B cell， 咁個 B cell 唔帶啲糖入去咧，咁啲糖繼續高啦，咁你嗰啲亦都多胰島素出嚟啊，咁啊繼續咧一路出就但係唔 work 嘅，咁你咪多呢個叫 insulin resistant 啦，呢個叫胰島素抗拒啦。咁但係當你做呢樣嘅時候咧，嗰啲膽固醇加埋血糖咧，就令到你血咧好結啊，好結嘅時候弊啦。咁呢個咧就係全身嘅身體咧，就一路慢慢咧就破壞身體。點解咧？佢全身去塞，咁你變咗有好多 plaque 咧，你個身體咧開始咧血壓就開始慢慢高噶啦。咁血壓高嘅時候咧，咁啊去第三個 stage 咧就係你繼續唔做嘢啦。咁第三個 stage 嘅時候，你個血糖高啦，咁嗰啲血糖咧係 attach 翻呢個紅血球叫 hemoglobin 嘅紅血球咧，咁啊紅血球咧佢就會有幾多個 percent 嘅血糖加黐住個紅血球。咁如果你係5.7咧係 normal 嘅，但係如果你去6.4咧，你就係5.7、6.4呢個前期患病嘅呢個嘅前期患病者糖尿病㗎。過咗6.5之後咧，你已經係糖尿病之後，即係第四個 stage。咁個個人 go through 1、2、3、4咧係都會有嘅。咁我希望咧教咗你之後咧，咁你又記住咧，你就會覺得好健康㗎啦，即係你一定會好有 motivation 去做嘢㗎啦。So how Lowsutea work is very simple. One Lowsutea has guava leaves, and guava leaves basically delay the absorptions of the sugar into the gut vessels, so they don't go in the gut vessels, and it will dump that out through fecal matters. And then your bitter melon act two very important things. One, it increases sensitivities of the insulin, so it takes sugar into the cells. But at the same time, when the sugar are not being used up, it dumped it out through urine. It dumped it out, the cholesterol also through urine, it's all dumped through salt and detox. So net result, you get a real good thing is you get rid of your sugar, you get rid of your cholesterol, you also get rid of your salt, then net result, you'll get rid of, will decrease your blood pressure. So that's how it works. 嗱，其實去糖茶好方便嘅，點解咧？就係第一，佢有兩樣嘢，有一個個番石榴葉，佢就當即係唔俾啲糖入去個血管裏邊啦，其實佢 delay 咗 absorption，佢入唔到去，咁啊睇個糞嗰度掉出嚟啦。第二樣嘢就係你嘅苦瓜咧係幫助啲糖 increase 嗰即係增加個胰島素嗰個 sensitivity 個敏感度，就帶翻啲糖入個個細胞裏邊。咁但係 excess 嘅糖點啊？佢尿嗰個掉出嚟。同埋佢又將嗰個 cholesterol 掉埋出嚟，再加埋咧佢鹽掉出嚟，咁你之後咧你又三低都會㗎啦。第一就會糖低啦，鹽呢個膽固醇低啦，仲有血壓都低。好多人飲咗之後咧腳腫都唔見埋。咁呢個係咁解，同埋有 detox 嘅 function 啊，即係將辣嘢掉晒出嚟。So that's how it works. Now, if you don't do anything, what can happen? Wow, that will be an issue, man. Because you know why? Because you don't do anything, you're going to have is potential, you have risk of stroke, you're going to lose memories, and you notice a lot of people lost memory as they're diabetic, elderly who keep asking the same question every 2-3 minutes, asking the same question. The reason is all these are plugged up the brain. They cannot transmit, so they cannot remember they have said that. Then you have your eye. We have a lot of people who have glaucoma and also cataract, all sort of eye problem, and can be very young age. I just have an engineer who is only 40 something. They have diabetic glaucoma already, and they have pressure of the eyes. They cannot see. Wow, that would be really sad. You don't want to lose your eyesight or get worse at age 40 or 50 years old. You have many lives to live, so do pay that attention. Also, pancreas will be damaged, so you need insulin. And really, most important is your heart. Your heart will be 40-60% of the diabetic person with heart disease. They can be able to heart attack, and they need to pluck up everything. And later, we'll talk a lot about that. Nerve damage is another big one, because nerve damage, you know what can happen? If you have a lot of people have nerve damage, you cannot feel. And also, another problem you're going to end up with the nerve damage is you will have all kind of problem from guts to brain to heart to all kind of muscle, bladder. Oh man, you never know. All these things were affected. High blood pressure is another one. And also if the damage of the vessels, because all the blood is clots everywhere. So you can have blood vessel damage. And on top of that, if you cut your foot, don't heal, you might end up cutting your feet. And diabetic nephropathy, as you know, this is a silent disease. And I had talked about it with Professor Larry Chan last week. They said a lot of people, when they see kidney malfunction, it's too late, can reverse. So basically, this is got to treat it very seriously. And also, you're going to have sexual problems because 30%, because they have nerve damage, they don't feel, they don't have sex. Okay, they cannot feel. That's too bad. Plus, people in pregnancy, they have what they call gestation diabetic. That can be a very serious issue too. So you really got to figure if you want diabetes continue, this is the potential risk you're going to have. 嗱，各位堂友記住，好多人咧唔明白咧，原來咧，當你有糖尿病嘅時候咧，你個風險係好鬼大嘅。點解風險大咧？因為好多人都唔知道咧，原來咧你會有中風啦，有眼嘅青光眼啦、白外障啦、胰島素破壞啦，咁你冇胰島素，你打胰島素啦。心臟病40%至60%人有心臟病啦，嗱神經系統損壞咧係 affect everywhere 嘅，係肚啦、心臟啦、個膀胱啦，哇好多人都唔知道有咁多 affect 喎原來，咁啊你個血壓會高啦，同埋你因為全身血管塞咧，咁好多血管就破壞咗啦，唔快得轉頭或者塞咗之後記住啊，咁你腳整親唔會好，你就破壞咗你就斬腳啦。上個禮拜Professor Larry Chan 講咗就係你個腎病咧整壞咗咧，當你整壞嘅時候咧，知道嘅時候要 too late， 所以咧要好啲，要早啲知道點去防禦呢樣嘢啊。咁同埋咧，好多人咧原來咧都冇性功能嘅，個原因咧就係因為當你有呢樣嘢嘅時候咧，啲性功能咧係30% 冇性功能，感覺唔到啊，個 nerve damage 咗啊。咁仲有咧，如果你 pregnant 咧，有好多有個懷孕嘅併發症啦，咁呢個係會將來變咗真係糖尿病嘅，所以要好注重。So our company is very different. We are the only company which really give you 5 programs, which is helping you on diet, teach you about dieting, teach you about diabetic management, and basically you gotta drink Lowsutea, for example, helping you out. We'll teach you about exercising. We teach you about weight control, your BMI go down to 25 or 23. We teach you about webinar to alert you how to build your knowledge base to manage diabetes. Last but not least, how to track your blood. And we have all kind of forms to help you to track your blood. You can manually track it and you can write to us and we can give you those forms. And that is what we do. So we have a whole program to help you holding your hand throughout your diabetic journey. Hopefully what we'll do is drive your A1C all the way to 5.7. I tell you, in our group here who listen today, many of them actually A1C is 10 plus and beyond. And they drop themselves below 6. And some of them even reach about 5.7. So they can be really remission. So keep that in mind, it works. So keep measuring and keep doing it. It definitely works. 各位朋友，我諗我哋淨係呢間公司咧係幫助咧你去教你哋咧或者去大家研討咧點去 manage 點去管理呢個糖尿病嘅。嗱，呢個好重要嘅，因為好多人咧就係講食，但冇成個套管理，呢度會成套嘢管理，咁就係俾好多 tricks 你啊，去教你去點記住啊，點管理啊。當你做到一樣嘅時候，真係 work 喎。嗱，因為咧我哋有食物嘅管理啦，即係減退呢個有一個碳水化合物嘅食物啦，降低你血糖啦，或者飲去糖茶啦，同埋咧點降低你嘅 cholesterol 咧，你膽固醇啦，教點 exercise 咧，每日1萬10步每日1萬步啊嗰啲咁啦，咁啊降低個 BMI 23啦，同埋教每個禮拜呢個 webinar 俾你聽啦，咁仲有點教你 track 你個 blood sugar， 呢個好重要。所以其實咧，我哋係 hold 住你嘅手 all the way throughout the years， 能夠令到你咧更加係了解同埋更加管理糖尿病。我哋太多朋友今日聽書，好多朋友就係佢嘅 A1C 係多過10以上嘅，但係跌到依家係 more under 6啊或者5.7啊。咁其實咧係可以咧去翻普通人一樣，但係你唔會好嘅，你要繼續努力，要繼續做頭先嗰5個 program， 你先能夠 maintain 到 5.7 嘅。就算你少咁過都唔得 ，OK？ 記住。咁所以咧呢個咧我係繼續一套係教你一路行住咁行咧，令到你身體健康嘅。OK，so we're going to talk about today pre-diabetic and diabetic. what will that do to your whole body? And now this is actually, we try to summarize it in such a way, very simple layman term, so that way you can remember, and we will give you some A, B, C, D, E program, very easy, A, B, C, D, E, you can remember, and so simple, okay? So that's what we're trying to do today. I think this is going to be so benefit to you guys. 嗱，各位朋友，今日好重要咧，就係我哋將我哋所講嘅東西咧，令到好簡單你容易 understand。咁簡單到咧，你係有 A、B、C、D、E 5點咧，咁你記住咧，咁 most 犀利咧，你已經開始做到我頭先講咧，你可以由你 A1C 幾多至10以上啊，可以跌翻落嚟咧，去到5.7㗎啦。所以變咗嚟講，呢個係好重要嘅，繼續努力嗱。首先 ，so actually we always ask ourselves, is it truly worth it to get your blood sugar under control, and then you will not get plenty sort of complications, so I eliminate that. But I don't see no complication right now. So why should I do all these? Now, patients actually ask me all the time. At nighttime, there are a lot of patients even say, Andrew, you know, I have no symptom. Why the hell I want to do all this? Although my A1C is already 8 or 9 and 10, but I have no symptom. I'm okay. But I tell them, you're okay now. Certainly, it doesn't seem to have any problem. But 5 years from now, you're going to have serious issue. And matter of fact, I just had a patient earlier come back to tell me, Andrew, I've been 8 years. I have no issue. She has identified as a diabetic since 53 years old, and now she is 65. And the doctor said, hey, you know, your blood sugar is out of control. And then if you don't do anything, you're going to end up need to have insulin. And she said, wow, gee, I didn't know I have to have insulin, because she don't feel anything. So net result, she started acting. And then at age 68, the doctor told her, said, hey, you're not doing anything. You know, your kidney function, it only get 40%. If you not drop 10%, you need dialysis. Then she got scared. Then she came back to us to work on very aggressively. She started doing the A, B, C, D, E, drinking Lowsutea and so forth. Now she drive her blood sugar below 7, but it's still around 6.5, but tremendous improve. So she is now acting. And she thought that, my goodness, I don't have any symptom. But now I realize that the data on the blood work really show it really have a problem. And really, at the end of the day, you got to understand diabetic impact every organ, your heart, your blood vessels, your nerve damage, your eye, your kidney, the GI tract, which is your gastrointestinal tract, your gum and teeth. I point out 1, 2, 3, 4, 5, 6 area. Probably you might not even think about, but those are the key area many people will come out on the, even as early 5, 6 years, will see that already. So keep that in mind. You have to really fix it. And this webinar will give you all the tips how to identify some of the symptoms and prevention, in a sense to help you eliminate all these major body health issues. OK， 嗱，各位朋友，今日講一講就好特別嘅，因為好多人咧就問，喂，係咪需要做咁多嘢啊？嗱，我已經係糖尿病有幾年㗎咯喎，但係咧我冇乜症狀㗎喎，我又冇咩話有咩需要即係減低啲嘢，咁我 OK 㗎，點解要做咁多嘢咧？又要行1萬步，又要減食嗰啲嘢，冇得開心，唔係嘛？嗱，其實我啱啱有個 patient 咧係53歲女士嚟嘅，咁佢係好特別，佢有8年咧係真係冇症狀，乜都冇症狀。醫生話：喂，去到65歲嘅時候就話咩咧？喂，阿太、阿黃太，你個身體現在好差，你血糖已經失控啦，你要開始打胰島素啊！哇！佢嗰陣時要驚，哇！要打胰島素唔係嘛？我都冇乜症狀。但係佢睇翻 data 嘅時候，如果你唔做嘢咧，你會衰落去嘅。咁佢係做好多嘢嘅，飲乜嘢又都飲，又飲中藥，但係跌唔到落嚟喎，因為佢冇個制度化去做嘢，佢又唔去 exercise，又唔去食管理，乜都冇，只係飲食藥或者食 醫生嘅西藥再俾中藥，兩個都做唔到出嚟。去到68歲嘅時候咧，情況更加嚴重啦。醫生話俾你聽，你個腎得40% 啫。如果你再唔搞，你個腎咧就會全部壞晒，30% 之後咧，你要洗腎啦。咁嗰陣時你知驚喎，咁佢就真係嚟揾到我哋咧，咁開始飲去糖茶，揾到差唔多6個月後咧，佢 A1C 跌到落under 7啦，佢個血糖咧係去到亦都 under 7，大概7至6.5之間咧，但係都未跌得晒。但係佢可以用功，咁個醫生咧就開始話：哇 ，OK， 你依家係控制到啦。咁但係咧，你要繼續努力，因為唔努力咧，你係做唔到嘢。咁佢繼續食緊藥啦。咁但係佢依家咧先知道，哇，原來糖尿病冇症狀，如果唔做嘢，我去洗腎㗎。哇，嗰陣時先知道，咁已經係好遲嘅。因為咧，阿 Professor Larry Chan 佢可能咧喺4%，只係停留喺4%，而唔可以再跌落嚟嘅時候咧，就啲糖高咧，佢亦都跌啦。咁跌到30%，弊家伙啦。佢可能20年裏邊都係4%，咁幾好啦。佢已經係68歲啦。咁20年即係已經過咗，佢可能好長壽嘅東西啦。咁佢其實 OK 喎，佢可能都唔會跌落嚟喎。佢90歲都唔會跌落嚟啊，咁幾好。所以點解嚟講咧，控制係十分重要。So very important, you got to control. And today we'll give you all the tips how to control your blood sugar, not to get into all the problems with heart, eyes, blood vessel, kidney, GI tract, and gum complication. Okay, one big topic is heart, and I will spend a lot more time talking about heart because I think previously we did talk about some question about heart, but I think it's so important to talk about your heart. Heart disease is a leading death actually for men and women. In United States, Hong Kong, same thing. Okay, leading death. Imagine that. Now keep in mind, give you an analogy. Your heart is like the engine of a car. If the car doesn't work, that's right, the car doesn't go, you die. Simple as that. So protect your heart is so important. Now the sad part is you have twice the heart disease if you are diabetic. If you are not diabetic, you are not. So 2 times, meaning you have 50% have more chances to get heart disease. As I said, 40 to 60% of diabetes person get heart disease. The longer you have diabetic, the longer you have heart disease. And most common heart disease, what is that? That is coronary heart disease. In other words, this is the coronary artery. There are 5 of them. And one of them is actually blocked or eventually more and more blocked. The key is the problem. If you're normal, there's nothing blocked, right? As time goes on, you're going to get fatty and all the cholesterol add together. As time goes on, plaque start forming here. Eventually, it forms more and more and start blockage. And that result, once the blood does not come across in 20 minutes, you know what? Your heart will stop because of the fact the muscles around here will die. And once it's dead, it's not going to work and it's not going to pump. Once you don't pump, you have heart attack. You got a sharp pain and you got a shoulder pain here. You better go to the doctor real fast because they have to relieve this blockage. This is very simple right here on the right-hand side of the slide. You have to remember this is really causing heart attack. Now, the problem with that too is when your plaque, cholesterol inside the artery, narrow artery, also besides damaging the blood vessel and nerve, also the heart not working can be also the same applied to your brain. So if you have the same issue, you could have stroke whereby your heart, your stroke vessel, micro vessel, all blocked up. Back of the part of the brain is not getting the nutrient, it's going to die. Once it dies, you get stroke. So that is, matter of fact, one of our lecture previously about stroke, one of the attendees said he saved his dad because I told him that, hey, if you got stroke, you know what? Don't go to the doctor's office. Go to hospital right away. And he went to take the dad after the stroke occurred. 38 minutes, he was in the hospital. So net result, he saved his dad from all kind of big issues of healthcare later on because of stroke. So handling your artery in the body, in a sense, your heart, your brain, your foot, all the peripheral arteries and things like that is so important. You want to prevent this cardiac disease or the heart problem because you're diabetic. So keep that in mind. This is a very important picture of you to recognize you don't want all these blockage right here. So 嗱，各位堂友，我要 spend 多啲時間講心臟。個原因咧，其實舊陣時都講過㗎啦，不過依家今次咧講得更加多啲東西。第一，心臟病咧係現在嚟講咧喺美國、香港都係一個最多人死嘅地方。OK， 因為你個心臟 work 咧，你一心停咗 ，guess what？ 唔 work 就唔泵㗎喎，唔泵你就死咗㗎喎，救唔翻你㗎喎。咁最大問題咧，即係你每 2 times 嘅occurrence 可以能夠即係話你有50% 多過普通人有心臟病嘅。如果你係糖尿病者 ，OK？ 喺個全世界 study 咧，60至40% 糖尿病咧都有心臟病。咁你計下嗰個 percent 好高㗎。咁尤其是咧長期嘅糖尿病者咧，更加多機會咧有係心臟病嘅。最常見嘅心臟病係咩啊？呢個叫做 coronary artery disease 啊，即係個血管落嚟呢啲咁嘅地方有5條血管嘅。咁佢係第一咧，如果普通人咧就冇塞啦。當你慢慢 build up 咧，呢個係幾年裏邊之後咧 build up 咗咧，佢有好多 fat 啊、plaque 啊加埋晒咧，咁就塞住咗喺呢度睇到啊。咁睇到啲血嚟唔到呢度咧，弊家伙啦。咁呢啲咧就地方一嚟唔到血咧，就有機會咧一塞咗你個心就唔 work， 一唔 work 咧弊啦，你個心就停咗你就會死，係咁簡單。咁你會有 sharp pain， 呢度個膊頭會 come up pain。又係會呢啲咧係要快入醫院，唔係醫生 office 啊。咁呢個咧係好重要。咁但係個腦咧一式一樣。如果你個腦係塞咗，一樣係啲血去唔到後面個腦嘅神經系統裏邊咧，或者個腦嘅細胞裏邊咧，嗰度會死。咁你就會中風。咁你就弊啦。你中風咗之後，個腦細胞死咗之後咧，係好長嘅時間先將腦細胞搞翻出嚟嘅。所以變咗嚟講咧，呢個係一個十分危險同埋咧個 cost 會好高。咁同埋仲有咧，就係好多時咧，唔淨止全身嘅血管都係同一性嘅同 heart 個心臟一樣㗎，因為會係全部腳啊又係咁塞，所有地方係咁塞。所以咧，你一定要唔好加啲血糖、加 cholesterol 一齊咧，令到佢咁係咁塞去。呢個係一個重要點啊，記住。As I mentioned, it is a leading cause for heart disease, for death, okay? So you got to really take action to prevent that. So what is the sign and symptom? Basically, normally for heart disease to show, I got to tell you, unfortunately, usually no warning sign. Matter of fact, many people have heart attack and stroke are suddenly came. However, some people have some other stuff which shows up is they start tightening their chest, they start getting pain, also usually pain here, like somebody, wow, with sharp pain, and also radiated up to the shoulder. Those are the already existing problem coming around the corner that you are going to get a heart attack. That's the reason why it doesn't have early sign at all. It might just happen, bang, wow, I'm getting a heart attack. Now, certainly when you're age 50 and above, you should have a normal health check, meaning that you have to take your blood pressure. You have high blood pressure, you have high cholesterol. If your cholesterol is all over 3.0 or 130, now you got to watch, right? For US is 130, Hong Kong is 3.0. And then you have high triglyceride, your LDL cholesterol is high, and your HDL cholesterol is low. Those are good cholesterol, HDL. So all those things come along, and your blood sugar is high, meaning your blood sugar is over 120, 130 or more. And then or Hong Kong will be more than 7. Then you know you have an issue on hand that might potentially get you into heart problems. So the blood test is very important to identify. Now, if your heart cannot pump well, one of the things that will show up is your leg will start forming some diabetes, meaning that you're going to have swellness of your leg or your ankle. And then also, if you have walking up the hill, walking some exercise, you have some hard time breathing. You have hard time, wow, sometimes you're short of the breath. That also indicate you have some major heart problem coming along. So those are signs that you have to watch, and you need to basically pay attention, maybe on your talk to doctor and find out, wow, hey, I have some problem. My leg is start swelling. You press down, it doesn't bounce back out. And then you have hard time breathing when I walk up, one store stair, even hard time walking one story high building. Your blood vessel in the leg is start changing color. You got to get leg cramp and less sensitive. And so the doctor might start doing an EKG on you, or so-called echocardiogram, which is talking about the thickness of the heart muscle, how well it works, and see how hard you're pumping. Also, if you do an annual exercise test, they even do what they call a exercise stress test. It's called the treadmill. So they measure your heart, doing EKG, see how you perform. So all those things we're talking about your heart, how it works. Now, interestingly is that if you are really going to have heart disease, one of the things that the doctor will talk about is, one, they check, are you a diabetic? If you're diabetic, you really got to control your diet. You have to exercise. You have to weight control. They have to measure your blood sugar. Your A1C got to be below 6.5. And the thing is, if you really have early sign of heart disease, you have to get treated. Don't delay, because you have to prevent that get worse. In other words, you don't want to get plugged up. Your heart continue to get worse. And when you get worse, you can reverse it. Because when you unplug everything, you know what? You have to do a bypass, meaning you have to get one of the vein from the leg and put it up in the heart, exchange, and get your vessel bypass. And that will be an expensive operation. So these are the things that you end up have to do. So you don't want to do all that. Then try to do when you're age 50, start understanding all that. Okay. 嗱，我會嘥好多時間講呢個心，點解咧？因為呢個係重要點嘅，即係你個車嘅 engine。如果車 engine 壞鬼咗點啊？哇，唔 work 嘅喎，即係會係好弊嘅，係咪？咁所以變咗嚟講咧，一定係要做呢樣嘢咧，係幫助你了解。第一，原來 heart attack 咧，即係呢個心病咧、心臟病咧，其實好多時係冇即係冇一個先兆俾你，或者有一個 sign symptom 俾你聽，或者咩有警告信號啊，話俾你聽。好多時啲人就哇心痛啊，呢度上去呢度喎，忽然間出現嘅。咁好多人都有呢個 heart attack 或者 stroke 咧，即係中風咧，都係同樣嘅經驗。但係亦都有好多時咧，你有初期嘅東西出現俾我聽，咁你就要注重話俾醫生聽。第一，血壓高；第二，你個膽固醇 LDL 會高；第三，你 triglyceride 會高，三甘油脂會高；第四，你個 HDL 係會唔高，但係會即係你好嘅 HDL 會低嘅。OK， 咁呢三樣嘢有之後咧，你知道你又好有問題㗎啦，開始。咁仲有咧，好多時咧糖尿咧就你個血糖高。如果血糖高咧有呢幾樣嘢咧，咁你心臟病咧係要開始注重㗎啦。咁第二樣嘢啦，你個心唔泵得好嘅時候咧，你個多數咧腳咧會開始腫啊，因為你泵唔到啲血上去個身體度，腳嗰度成日都會腫啦。咁你撳個腳眼咁撳落去咧，唔彈翻上嚟嘅，咁你就知道你已經有問題啦。仲有行一堂樓梯，你都氣喘嘅，咁亦都有問題。同埋仲有隻腳咧，你個腳嘅腳嘅色咧，亦都會轉咗藍藍地色啊，唔係咁靚仔啊，同埋你好多時咧有抽筋啊，亦都唔係感覺好咧。咁呢啲咧全部都係嘅 early sign 跡象咧，係你有嘅心臟病。咁仲有一樣嘢咧，好多時因為有呢樣嘢，你就要可以做咩啊？做個心電圖啦，同埋有個即係呢個 echocardiogram 就係有啲用咗一個心臟嘅聲掟咗去，掟翻出嚟，咁佢知道個心你厚幾厚啦，同埋咧或者要做個 track 呢個走嘅時候咧，佢用嗰個快步測試嘅時候有個 EKG 睇住你係咪 OK 啦。咁仲有咧，其實咧仲有好多時咧， 你如果又是糖尿病咧，佢醫生一定話俾你，喂，你 A1C 要降翻低過6.5喎。咁同埋咧，仲要咧喺呢方面咧要做 exercise 啦，要 diet control 啦，即係要食物控制啦，要減磅啦。咁所有啲嘢全部咧將你個你個心臟嘅地方降低嘅風險降低。其實好重要咧，如果你血糖降低，你磅數降低，你個脂肪降低，個 chance 你有心臟病咧係低好多嘅，因為佢唔繼續塞你個血管。OK， 明白嗎 ？OK，so importantly, you have to control really your high blood pressure, your cholesterol, your triglyceride, and blood sugar. If you can do that, the chances of you getting heart attack are much less. So really, at the end of the day, you got to do a whole lifestyle changes. And what that means, you have to have low carb diet, low fat diet. Two things, carb and low fat. Another thing, you have to eat more vegetables. You have a lot more beans. You have a lot more whole grain. You have to limit processed food like chips, sweet, fast food. And then you also need to get rid of the soda, like Coca-Cola, forget it. Drink less and don't drink a lot of juice. Sweet juice is not going to help you. And certainly drink Lowsutea because that will help you lower your blood sugar, your cholesterol, blood pressure, and detox. Plus, if you lose 10% of body weight, lower than 1% of A1C, if you lower 10% body weight, you will lower your A1C about 1%. So in other words, if your A1C is 7 or 8, you drop down to 7. And if you are 7, it should be dropped down to about 6. That will tremendously help you. I myself lost from 225 pounds. Now I'm achieving 190 pounds. With that, my A1C actually dropped tremendously. It got me down to 6 now. And with that, I'm feel much better. My blood sugar feeling much better. And a lot of people tell me the same thing. And now you also, one more thing, you have to keep yourself active with exercise because exercise will increase your insulin sensitivity, it control your blood sugar, lower your risk of heart attack. Mean you have 150-minute exercise per week. If you're a smoker, hopefully you can stop smoking because that will actually give you a lot of heart disease. You have to manage your rest, you manage your stress, increase your blood manage your stress, then you can decrease your blood pressure because stress increases blood pressure. And then with all the bad behavior like alcohol drinking, overeating with snack, with chips, all that, if you get all that, you will do really good. So really at the end of the day, lifestyle change will help you to prevent your heart disease. Do it. You can. I can do it. You can do it. Okay? 各位朋友，我講咁多嘢咧，好重要咧，就係你要改變咗你生活習慣，能夠改變你個心臟病嘅風險。咩叫改變心臟風險咧 ？For example， 第一喺個食物裏邊咧，要改低嘅碳水化合物嘅食物，低脂肪嘅食物。咁咩嘅係呢啲嘢咧？食多啲菜啦，我咪講咗一隻碟裏邊，一半係全部綠色菜，任何綠色菜都得嘅。第4分1就係你個 lean protein， 即係少肥嘅蛋白質，好似瘦肉啊、雞蛋啊，全部即係瘦嘅東西。OK， 咁仲有咧要食好多 whole grain 嘅嘢啊，即係全麥穀物嘅東西。咁你就可能夠咧將呢個整體嘅食物咧係能夠令到係好正嗱。好多人問喎，喂係咪冇苦俾你食唔到？唔係，你係食到好多嘢嘅，譬如豆腐啊，中意食。即係你可以好多書啊，好多嘢教你點做呢啲低糖、低呢個全部係菜，同埋咧又可以食到好多低嘅肥嘅食物係有好多嘅，亦都有好多低嘅碳水化合物，就好似餅食都有。我哋亦都教過你好多次啦。咁如果係咁樣遲啲，我哋再整多幾個咧，有個甜食嘅東西咧係能夠2-3個卡路里啊，5個 gram 嘅。carbs 嘅，咁你咪可以食到咯，係得嘅。咁同埋咧，你唔好食咁多啲 chips 糖啊，同埋啲出去食 麥當勞嘅嘅好似French fry 啊嗰啲就唔好食嗰啲啦，因為嗰啲係真係對你麻麻地嘅。咁同埋咧，仲有咧，譬如飲汽水啦，同埋飲好多酒啦，呢個亦都唔得嘅。咁最好就飲去糖茶啦，因為去糖茶會降低血糖啊，降低 LDL cholesterol 啊，同埋降低你個血壓啊，仲有 Detox，OK，咁幾好啊！即係同你減晒你啲壞嘢排埋毒出嚟，哇！真係正到暈係咪？咁如果你減10% 嘅磅數咧，你係減低你 A1C 1%嘅，記住啊！咁亦都能夠減低血糖啦，減低你嘅三甘油脂啦。咁呢啲嘢全部幫助你降低你嘅心臟病嘅風險。咁仲有咧就要 exercise 啦，你一定要 exercise 咧，因為 exercise 增加你胰島素嘅抗拒啦，你嘅亦都降低你血糖啦。咁仲有咧就唔好飲酒啦，要降低你嘅工作壓力啦，因為如果工作壓力高咧，點啊？我哋 blood pressure 高咯，係咪？咁呢啲嘢咧全部幫助你係降低你嘅成個心嘅風險嘅。Now, I will give you a very, very good, easy to remember 5 step. A is hemoglobin A1C, blood sugar. So you drop down A1C. You really drop down A1C. B, you have to control your blood pressure. Control your blood sugar. A is control your blood sugar, A1C. B is blood pressure. You have to control. C is control your cholesterol. Lower your LDL. D is your diet and supplement. Low carb diet, low fat diet. E is exercise. So if you can remember A, B, C, D, E, these 5 things will definitely help you to lower your heart risk, and your whole body will lower all the different risks. Certainly in your diet, make sure you drink Lowsutea. OK？ 嗱，各位朋友，我俾呢個 secret 俾你咧，就 A、B、C、D、E。A 係咩嘅啊？ A 係降低你嘅 A1C， 血糖裏面嘅 A1C 降低。B 係咩嘅啊？ B 係你個 blood pressure， 你個血壓要降低。C 係咩嘅啊？ C 係你嘅 LDL 嘅膽固醇要降低。D 係咩嘅啊？ D 係你個 diet 食嘅東西，同埋你個營養嘅東西，飲去糖茶降低血糖。D 係喺 diet 上咧，所有係低碳水化合物度食嘅東西。E 係咩嘅啊？ exercise 運動。嗱，各位同學你可以影張相嘅，呢個係好重要咧，幫助你影張相之後咧，你要記得，咁就係 A、B、C、E。So I would suggest you take a picture if you can about A、B、C、D、E. So net result with that, you can remember A is your A1C, B is your blood pressure, C is cholesterol, D is diet, E is exercise. If you can do that, I can assure you, you can be healthy. Now, we talk about blood vessel damage. Remember, you have everything, your sugar and the cholesterol plugging everywhere. Remember this? You become all forming fat and all that. By the way, when you have that, diabetic is 10 times more because of this plugging. You will not gonna feel. So net result, the patient, the toe, the feet, they end up have to remove it because they get infected, they cannot see. So we have to manage that tremendously. Blood vessel damage is the plugging, and also nerve damage that will cause the problem that you cannot feel. So we have to talk about food complication now. Now in pre-diabetic, diabetic is the same thing. By the way, a lot of people don't realize 70% of diabetic patients will have neuropathy, meaning that their nerve is being damaged, they cannot feel. So result, they will have high blood sugar, and nerve damage is very, very common. 70% is a high number. And they start losing the feeling and the hand. And basically, a lot of time when you're sore, you don't notice and you don't feel pain. So you don't get, well, eventually you get gangrene, you got to cut out your foot. Imagine that. That's terrible. 嗱，各位堂友記住， 喺腳方面咧，因為個問題咧，你記唔記得個血管係塞住晒，咁同埋你啲神經系統又塞咗，咁你感覺唔到啲糖咧同埋啲cholesterol 塞住晒咧，咁你好弊啦，因為好多呢啲嘅咁多嘅神經系統塞咗之後咧，你感覺唔到咧，咁70%嘅糖尿病者都有呢個神經系統嘅併發症嘅。咁如果係咁嘅話咧，有陣時因為你感覺唔到咧，你發炎咧，你塞晒咧，oh sorry， 咁你咧就弊啦，因為個問題咧，你就會變咗咧係冇感應啊，咁變咗你亦都唔會heal佢啦。咁你唔 heal 佢嘅時候咧，發炎之後咧，你就變咗會變咗壞咗啦，咁折就變咗隻腳會 end up 折咗支。sorry。嗱，常見嘅 complication 係乜嘢啊？常見嘅 complication 咧就係隻腳咧，呢啲起咗泡喺邊度啊？呢啲起咗泡啊 ，sorry。咁你起咗泡嘅時候咧，呢度咧就會腫咗啦。呢啲水泡唔會好嘅時候，一發炎咧弊家伙啦。呢啲就係會 end up 咧頭頭就係呢啲咁嘅細嘅地方，發下咧唔會好咧，你就變咗 gangrene。即係腳成壞到咧，要割咗隻腳。Okay, what are the common problem with diabetic on the feet is that they have all these blisters. The blister don't get well, or the corn don't get well. You're gonna end up because of this. You don't take care of it. You don't put a band-aid over it to cover it, make sure they don't pop and they don't get infected. They don't get well. Eventually, especially like problem like this, eventually become a gangrene. You have to end up cut your foot because of that. Wow, imagine that. That's terrible. So managing your fit, it'll be really a daily thing, and especially a high blood sugar. You have to really, for even pre-diabetic will comes on actually very early. The leg become dry. You start losing feeling. You're gonna feel, just dry foot, and you're gonna feel less sensitive. So your feet is really important. So some of the things that you got to remember, you don't want to test your feet just touching hot water. You do not want to wear footwear without cover. You always want to wear socks to protect your feet. You want to go barefoot, go outside and get injured. You want to decrease the risk of infection, keep the whole body, the foot. You want to keep it moist, not to get, too dry. You got to talk to the podiatrist to actually talk to them to understand your foot problem. You have to basically maybe wear real good orthopedic shoes that, is round rather than sharp corner. You have to have low impact exercise, not to get too much pressure and hit your foot. You have to improve the foot circulation, control your blood sugar, avoid diabetic neuropathy, working closely with a doctor, and really general diabetic health. So those are things that you really have to do to manage your foot. Okay， 各位朋友，你係需要咧，真係要幫助你咧個 feet 隻腳嗰度要好嘅，因為千祈唔好揾隻腳咧睇下啲水夠唔夠熱啦。如果係咁講嘅話，你又好大問題啦，因為你一辣到自己腫鬼咗就弊家伙啦。要着襪啦。同埋咧唔着鞋行通街行咧，或者喺屋企行咧，你整親隻腳咧發炎就弊家伙啦。咁仲有咧，你係要幫助你個身體成日唔好咁乾咧，唔好整到太乾嘅時候咧，你令到你隻腳會即係乾得嚟就會損咗個發炎啦。咁同埋咧就仲有咧就唔好俾個腳咧。係會整傷，如果整傷咗，快去睇醫生或者睇你個腳嘅醫生啦。咁同埋咧，最緊要咧唔好做嗰 exercise 咧，好多時咧撞到做到腳咧係好痛嘅，或者着鞋咧要圓揼著，唔好有個壓力啦。最緊要最後咧就係要俾你能夠好對隻腳個血液循環好啦，同埋咧仲要咧就要繼續去控制你血糖咧。唔會俾佢有呢個神經系統嘅損壞，同埋咧繼續同你醫生繼續講啦，繼續去幫手咧係管理嘅血糖，呢個好重要啊。So other problem in diabetic is the nerve damage. As you know, nerve damage is all kind of damage. They also have internal organ like a gut. Remember last lecture we talked about gut. Your body actually have a problem with the gut. and it affect your your stomach, and also affect your large intestine. So your digestive system has all kind of problem can come in because nerve damage. Sexual problem, 30% of people have no sex because they cannot feel. And then they also sometimes, some of the people even cannot feel the bladder being full because the nerve damage. So they start leaking, or they can't get rid of the urge. So some people even have nerve pain. If they have nerve pain, some doctor even have to give them anti-convulsion drugs to get them the nerve decrease nerve pain. So these are the really problem that can see in many people. 嗱，仲喺糖友仲有咧，糖尿病者仲有好多神經系統嘅損壞咧。上啲堂都講過咧，肚啦、胃啦，呢啲全部 damage 嘅時候咧，你就會令到你個胃好唔舒服，成日都同埋或者有個便秘啦，仲有咧好多時咧就有你譬如好似性嘅功能冇咗咧，你感覺唔到啊嘛。咁同埋有啲人咧就係令到連個膀胱滿啦都 feel 唔到嘅時候咧，就去小便都有問題嘅。咁同埋仲有咧就好多人咧有個即係個神經係痛啊。咁好多時咧就要醫生咧俾藥佢食啦。咁呢啲咧多數係嗰啲即係 convulsion 嘅藥啦俾佢啦。咁所以變咗又會係一個好大嘅問題出現。所以個 nerve 咧係喺呢度咧，你一定要控制糖咧，唔好搞到搞壞啲即係個神經系統。呢個係一個好多時糖尿病都唔知嘅，呢個就知道之後咧，咁你就知道啊，可以幫到好大。Another thing too, the leading cause of vision loss, especially in U.S. for example, 20 to 70 years old, many the vision loss because they're diabetic. So if you're diabetic, there's a potential, even as young as 20 years old, you can lose your vision. I have people that come to see me at 40 years old, they lose their vision or they already got blur. So they might not lose the vision completely, but they are blur, cannot see. That's a similar thing. They have to have all kind of problems. So that's really sad. If they live to 80 years old, that means they have 40 years, they have no good vision to work on. It's how bad that is. So diabetic could cause any kind of blindness if you're not treated. You have to really aggressively look at that. Like for example, some of the problems you have glaucoma, cataract, diabetic retinopathy, meaning that the retina are being blocked because all these vessels are being stuck. And then the macula, this is the area they are swelled up. So in that case, everything you see is not going to blur. You have floater, you have black spot, your vision become divided because it swelled the macula. And then your color description is even in black, red, and blue. You are not getting that. You can actually see a different color. And also, at the end of the day, you don't do anything to it. You end up with blindness. So that is a very sad story for everybody. So let's fix this. If you have diabetic issue, I early see your doctor, get it fixed because it will take time to get it fit. To get it fixed. 嗱，各位糖友喺糖尿病者咧，20歲、70歲咧，好多人係眼盲嘅。個原因就係因為糖尿病，所以呢個係一個大嘅問題出現嘅。好多人都唔知道，原來糖尿病咧，我哋白再咧青光眼咧，亦都呢個眼膜嘅變咗佢啦，好似呢啲視膜角嗰個 nerve 啦，或者視膜角呢啲 vessel 咧，因為全部塞晒就變到好大隻啦，咁啊睇唔到啦。咁同埋咧，呢度咧呢個 macula 咧又腫咗啦，咁你啲嘢出嚟咧就好會 blur， 變咗即係睇唔清楚啊！顏色咧紅黃白咧變咗紅色藍色咧，全部都錯顏色嘅。咁樣嚟講咧，就最後咧，如果你真係唔處理咧，就會盲啦。咁呢個係一個係好重要嘅。好多人就只係話啊係，我記得有 cataract， 但係冇去真正處理。呢個係快處理。如果你唔處理咧，弊家伙啦，真係好快咧，你就搞唔翻嚟，因為盲咗之後點啊，翻唔到嚟嘅。OK， 記住 ，if you blind, you cannot go back. OK， you blind forever. Keep that in mind. So diabetic kidney disease is one really important. Imagine 9th leading deaths in the United States is 30 to 40% of the people die of kidney disease. And as you know, DKD, which is called diabetic kidney disease, 40% of the people 30 to 40% of people will actually get DKD. DKD, 30 to 40%, you didn't hear wrong. And at the end of the day, if they don't get taken care of, they end up with dialysis, either the hemodialysis or CAPD. So DKD is a serious issue. As I talked to Dr. Larry Chen last week, it will give you high blood pressure, high blood sugar, will damage your your kidney. High blood pressure, high sugar, two things will damage your kidney. And usually the symptoms are known. Usually you don't feel anything until too late. 80% of the people actually, when they get the show up with symptoms, then they say, wow, I have kidney disease. So before that, you have to alert the doctor. You have to even alert your, if you're diabetic, you even have to remind your family doctor to say, hey, look, man, you know, I might be checking my kidney. You got to check your kidney with a GFR, the percentage of kidney function, because your creatinine won't show up until very late stage. Your called glomerular filtration rate. If you have 40%, you really got to take care because you have no symptom. And you got to tell the doctor, tell me what is my GFR. Now, suddenly you might have some other symptoms show up, but that will be all in the late stage. Like, for example, your hand starts swelling, you got itch, your muscle cramp, it's nausea, vomiting, back pain, loss of appetite. But all those are very late stage already. So you want to make sure, tell your doctor, hey, can you measure my GFR so I know, because I'm a diabetic, so you can have measurement. You have a baseline, and then eventually, maybe every year you check, so get you to understand what's your kidney function. 嗱，各位朋友，好重要咧，其實咧喺美國啊，係如果呢個腎病死咧第九個重要死亡嘅率嚟嘅，30%至40%嘅病人咧有糖尿病咧會 eventually 咧就變咗有個糖尿病嘅腎病嘅，30至40%，你冇聽錯啊！多數啲人咧血壓會高啦，糖會高啦。咁但係好多時咧係冇症狀出現喎。當你有症狀出現嘅時候，要 be too late。所以你可能要話俾個 doctor 聽啦，醫生啊，喂，你政府醫生夠好啦，如果私家醫生聽，喂，你可唔可以俾個 GFR 我知道啊 ？GFR 就係我個血個腎功能有幾多百分幾？咁叫佢俾個 GFR 你咧，咁最緊你都知道你個底線係幾多啦。咁你如果你嗰陣時 知道係得咗60%，一路繼續 monitor 嘅。如果得40% 嘅時候咧，咁你就真係好似我個堂友黃太太咁啊，佢得咗40% 嗰時開始驚啦，因為醫生話3個你要洗腎啊嘛。咁所以咧，你一定要繼續努力咧，係追尋呢樣嘢，你嘅 GFR 有幾多？當你嘅腳腫咧，又好啦 ，itch 啦，有抽筋啦，成日要嘔啦，又有作悶啦 ，back pain 啦。同埋咧有個口啦，好似有啲鐵嘅金屬嘅味道出嚟咧，哇！已經 too late 啦嗰陣時係已經你個腎已經功能好差噶啦。咁你唔想去嗰度咧，就早啲 GFR 會更加早話翻俾你聽嘅。嗱，記住我哋亦都俾個 ABCDE， 如果你係控制到 ABC 嘅 chance GFR 低咧，都唔會喺度。A 係咩啊 ？A1C 降低6.4以下。 blood pressure 血壓要係降喺120至130以下。第三膽固醇 LDL 低過 2.0， 低過 2.0 LDL。如果喺美國咧係要低過70 ，OK？ diet 要飲去糖茶，低碳水化合物，同埋你要食好多 low fat 嘅低鹽、低糖、低脂肪食物。最後 exercise。如果你做晒啲嘢，一定對你個腎功能好大幫助，同埋你個 GFR 一路繼續行，唔會跌落嚟。OK？ So very important. We really want to preserve your kidney function is the key strategy on DKD. So you want to do that is A, you prevent your A1C drop down to 6.4. I mean, you have to make sure your A1C drop down to 6.4. You want to drop A1C to 6.4 or below. And then you have to control your blood sugar, pressure of 120 to 60, 70, or 80, around there. You want to have cholesterol, LDL, make sure is 70 or lower. Now, if you are at 100 or more, you got to drop it down lower, okay? Your diet, you have to have low carb diet, low fat diet, low salt diet. And on top of that, you have to drink Lowsutea to help you out. And you have to exercise. So A, B, C, D, E. Do that, definitely you will preserve your kidney. Now, we have talked about really in a sense that nerve, it will affect your gastrointestinal tract. And if you are not control your diabetes, it damage the nerve of the stomach, your large intestine, all these things will be, continue to get worse. One of the big things is people who have problem is they see all the time is constipation. This is number one. Matter of fact, everybody pre-diabetic diabetes will also have that because you start seeing your really hard to go, your stool become one piece, like marble coming up. That is the problem that you will have when you are your poor circulation of your gut, your nerve damage. So the key here is one, to treat that, you have to drink enough water or drink Lowsutea instead of water because you will get already 2 liters Lowsutea every time you drink each day. So you get enough water to lubricate all your stool, then that will come up much easier. You can drink Lowsutea warm in the morning, and on top of that, it will warm up, get your gut to relax, then you can push it out. You have to also increase more fiber diet, like vegetable, cut down the carb, not sweet cereal. And third, and last but not least, you have to exercise. Net result, you are able to feel that you have ready to go. Once you're ready to go, go poop. Don't wait. Don't let it go back to the dryness of the pool. So when you feel urge, go to poop. That is the key to get your GI work perfectly. 嗱，控制個腸胃咧，好多時咧，你血糖高咧，係會破壞咗好多你個肚嘅血管嘅，同埋你嘅肚嘅神經系統。咁當你有呢樣嘢嘅時候咧，好多時咧就會有咩個問題咧，就便便啦。咁你大便都會一粒粒好大粒咁大粒呢粒出嚟嘅，咁啊好難出嚟，谷都谷唔到。咁啊點樣做啊？嗱，好重要，第一要飲夠水，每日最低限度有2公升水。但係唔使飲水啦，因為你如果飲去糖茶，你有2公升嘅去糖茶飲啦，再加多1公升水，即係3公水啊每日。咁你嘅大便咧先能夠多水分咧能夠推出嚟。如果飲去糖茶係一個暖嘅去糖茶咧，會更加好啦，令到個 gut 係會 relax 啲啦。咁變咗嚟講咧，同埋你唔好食嗰啲甜嘢啦，要食多啲 fiber 嘅嘢咧，即係有纖維嘅食物啦、蔬菜啊東西啦，同埋減多啲少食個碳水化合物嘅東西啦，唔好食甜嘅麥皮啦，多運動啦，同埋一要去嘅時候幾大即刻要去，因為咧 urge 嘅時候你嘅 cycle 要 urge 咧，你要去就要去啦，唔好等啦 ，OK？ And a lot of people forget about teeth. Actually, diabetes has a high risk of the gum being swallowed up and got red swollen. You got to keep brushing the teeth, and you have to make sure maintain the gum are really healthy. If not, you get infected. So you have to see a dentist at least every half a year. Brush your teeth good, avoid gum disease, and so you can end up pull up your teeth. So that will be one complication you want to eliminate because gum, you want to keep your teeth good. So even at 80 or 90 years old, I can still eat. So that will be very important. 嗱，各位同學，好多人 forget 咗唔記得咗牙齒嘅重要，牙齒健康好緊要。因為如果你係糖尿病，好多時咧會有咩發炎啊？會牙肉發炎，牙肉紅腫啦、脹啦，同埋要出血啦。咁有發炎咧，你就好弊家伙啦。所以呢個係好重要嘅，繼續做呢樣嘢，繼續刷牙，繼續要啷口，用呢個 Listerine 啊咩啊落口藥都得嘅，唔好俾你有牙肉發炎，同埋咧你變咗你唔會有即係要剝牙咁慘啦，係咪？咁咧同埋咧就希望咧變咗佢唔會繼續咧去 damage 你個牙嘅健康 ，OK？ 咁呢個係好重要嘅。咁啊，結論啦嗱 ，so this is the summary whereby you really got to get lifestyle changes and whole control your blood sugar. You have to slow down your blood sugar going up so you can able to decrease the chances of diabetic complication and keep your blood sugar under control. That is the key. Many of my clients, they drink Lowsutea, they keep themselves under A1C of 6.4, they got like healthier. A doctor was surprised, so they cut down their medication. They don't have diabetic injection anymore, like insulin I'm talking about. They lower the medication. So with that, the A, B, C, D, E become so important because they will help them to prevent heart disease. They help them blood vessel and nerve damage, decrease the eye problem, and then you will also decrease your kidney disease, which is DKD. As you know, DKD has no really sign symptom. It will decrease the gastrointestinal tract problem like constipation. Last but not least, you help them on gum disease. So drinking Lowsutea becomes so important. Now imagine this. This is the heart. And you can see over here are all what? Eating a lot of food, doing exercise, your weight control, everything is talking about that. You can take a picture because that way we can able to think about A, B, C, D, E. Important, A1C, B, blood pressure, C, cholesterol, D, diet with Lowsutea, low carb, low fat, and E, exercise. With that, you for sure lower your chances all that problem on the left hand side. 嗱，今日講座咧講完啦，但係好重要咧，我做個總結咧。第一，你一定控制你個血糖，唔好俾佢上高。同埋咧，冇咗血糖上高咧，有個好處咧就係第一，你會係見到咧控制咗血糖咧，你所有嘅病糖尿病嘅併發症咧就唔會出嚟嘅。咁唔會出嚟嘅時候咧，個醫生就會幫助你話可以食少啲藥啦，唔使打胰島素啦。咁同埋仲有咧係對成身嘅身體都好正嘅，你可能夠繼續享用你個生活好生活，同埋咧去見你嘅親戚朋友同你孫玩你係幾開心咧。其實呢樣嘢係做得到嘅，記唔記得佢係 A B C D E 我依家再講。但係做咗之後咧，幫助你減低你心臟風險，減低你血糖，所有血管嘅塞同埋你個神經系統損壞，仲有咧又減低你眼會盲嘅機會，減低你個腎病嘅風險，仲有個肚腸嘅風險，同埋你個牙齒嘅壞嘅風險，哇幾好做晒。咁 A、B、C 咧咩？第一 A1C 你個血糖。要控制 A1C 減低個6.4。第二就係你嘅 blood pressure 個 B， 你個血壓要去到120，同埋去到80， 120/80。第三，你個 cholesterol 膽固醇 LDL 要降低到係去到 under 2啦，咁更加好嘅1.8嘅，咁講2你 remember 啦，2 under 2咁你 OK 啦。如果美國咧係 under 70 ，OK，under 70 ，OK，E 就 exercise 由 diet 就要 control 啦，你個 diet A、B、C、D，D 就 diet 就係你個低嘅碳水化合物啦，要食低鹽同埋低呢個肥嘅食物啦，再飲去糖茶啦。E 咧 exercise， 當你做晒呢啲嘢咧，呢張相就真係好適合嘅。就係能夠令到你咧係降低你嘅全部頭先所講嘅風險。好，即係多謝你咧就能夠繼續聽我哋説話呢個嘢啦。Okay, right now we answer our question. It's very good. There's a lot of I thank you for Miss Zhang or Mr. Zhang or what ask a question. Okay. I don't understand. 點樣叫咩叫請看牙齒筆記啊？我唔係好明白你個問題，或者你講多些少。咁我話依個咩叫牙齒筆記咧？我想了解多啲。嗱，其實牙齒咧，你每2年咧係應該睇你個牙醫生一次嘅，每2年應該睇牙醫生一次。OK， 咁呢個係重要嘅。或者你可唔可以咧你俾個電郵我咧，或者我可以答你一啲好啲啊。OK， 哦 OK，I see。OK， 呢個係咪呢個啊 ？OK，so OK，I can see Miss Zhang was asking. She wants to have this picture basically. So we have this picture come up. So I think that's what you want. But anyway, if you have question, you have problem, give me an email. I will answer your email on this too. So you can help me. It would be great. 如果有其他問題咧，你可以俾個 email 我嘅，咁我就可以咧係俾大家睇到啦。咁或者如果你係需要咧，亦都可以問我其他問題 email 啦，咁我希望喺度答你。So no worry, you have questions, send me an email. I will answer you also in email, or maybe we'll chat a little bit. We have a lot of people actually ask questions. Be after my class, we do that all the time, and I'm very happy to answer a question. Okay. So, wow, very good, Ms. Zhang. Thank you very much. You have given, okay, what is your email address? Right here. This is the one. NDANDYDLAU@gmail.com. I write it down here again. Can you get it? My email address is NDANDYDLAU@gmail.com. Okay. I hope Ms. Zhang can, or maybe you can give me your email address. I type it there. I can able to hope that I can answer you too. Okay. All right. So any other questions? We can help you answer your questions. Okay. Well, I appreciate it. Sorry I extended 15 minutes, but I talked a little longer on the heart disease. And so that's why I thought that would be important to let people know important of heart, because the heart doesn't work, man. You will have lost everything you fight for. Okay. So do not ignore your heart health. I worked as an ICU nurse for a number of years. I saw too many people die because of the fact that the heart doesn't work, and I can't save them. And it's very sad. Rest of them working, the heart doesn't work, is the end of story. So you gotta fix your heart first, okay? No matter what, fix your heart first. 嗱，各位堂友，因為我近時係一個 ICU nurse 嘅，咁當我做 ICU nurse 嘅時候咧，見到好多病人咧，最大咧就係佢心臟唔 work 啊。唔 work 就死㗎啦，咁死你做咩嘢都搞唔掂㗎啦，咁所以變咗係一個好即係我心過唔到去咧，就我點救你救唔到啊，係咪？咁所以個心臟咧係好嘅，所以 spend 好多時間喺心臟度 ，OK。So good, thank you again. I appreciate all your time. I appreciate that you can able to answer. I hope that I answer all your questions. And maybe if you want to send us a WhatsApp, you can send us a WhatsApp. We hope we can answer you. This is our phone number, WhatsApp number, and also our email numbers right here. I think I have my email number here too. So you can give email address here. You can also look at that. You can copy down my email, take a picture if you want to, and call us if you want to. That would be good. So thank you very much. I appreciate all the time talking to us and asking questions. Thanks, Ms. Zhang. Thank you for your question. 多謝晒阿曾小姐幫助我哋問啲問題啦，好嘅。 因為呢個係幫助我哋好多朋友咧都聽多啲不同嘅東西啦，不同嘅觀念啦，咁啊好 OK 嘅。Okay, have a nice weekend. Thank you very much. I appreciate all the time joining our webinar. Goodbye. Bye bye.